Hello, I'm Bhagirathbhai Dholaria from Vanderbilt University Medical Center, Nashville, Tennessee. Today, I'll be talking about the role of allogeneic stem cell transplantation in patients with chronic neutropenic leukemia. Chronic neutropenic leukemia is an extremely rare but very aggressive pH-negative myeloproliferative neoplasm with no good prospective data because this disease is extremely rare. Now, the previous experience with allotransplant, which is the only potentially curative therapy for this disease, has been limited to a few small case series. So we conducted a large international observational study combining the data from CIBMTR and European bone marrow transplant registry of 29 patients with CNL who underwent allogeneic transplantation from year 2000 to 2018. And what our study showed that in our patient population, majority had received myeloablative conditioning and PBS3 stem cell graft from a fully HLMH sibling or unrelated donor. And our transplant outcome showed that there was a quite high relapse rate at 4 years, around 35%, but the non-relapse mortality was relatively comparable to what you would expect in this type of MPN allotransplant, which was at 4 year NRM was 13.8%, which resulted in disease-free survival at 4 year of 51.7% and overall survival was 55.2%. Among the patients who had death reported at the time of study follow-up, the most common cause of death was still relapsed CNL, followed by infection and graft versus host disease. So this is the largest of this analysis of 29 patients with chronic neutropenic leukemia who underwent allogeneic stem cell transplantation from different donor type and conditioning regimen. But our study results showed that transplantations can provide durable disease remission in this patient population with acceptable non-relapse mortality. However, because the small number of cases, we were not able to further define the different intricacies of pre-transplant variables and donor type, specificity of conditioning regimen, and its impact on subsequent transplant outcome. Next, I will be talking about the timing of allogeneic stem cell transplant for chronic neutrophilic leukemia. Certainly, the outcome of CNL are much worse once it has progressed to a blastic phase or secondary acute myeloid leukemia, because those patients do considerably worse after allogeneic stem cell transplantation compared to CNL patients in the chronic phase. Now, in patients with chronic phase CNL, also the outcomes are relatively poor without allogeneic stem cell transplantation. And there might be a role of some pre-transplant therapies to optimize the bone marrow and spleen status to improve the outcome of transplantation. Recently, there was a phase 2 study showing quite impressive results with using the targeted therapies such as ruxolitinib in a patient with chronic neutrophilic leukemia. And also there was some suggestion that it might have some disease modifying effects. However, in our study, because of small number of cases, such conclusion cannot be drawn. And the larger, more cohort studies are needed. It probably will require much wider international collaboration for this disease. Thank you so much.